Ladies and gentlemen, live from the historic Bourbon View venue in the heart of the French Quarter in New Orleans, Marco is pleased to present a distinguished 5-surgeon panel to discuss the most current applications of integrated wavefront diagnostics. Your moderator for this evening's recorded event, Dr. Larry Patterson from Crossville, Tennessee.
Mitch, I've got a question for you. There's a lot of information we can get before cataract surgery, and there's evidence that certain data points, things like Angles Kappa and Alpha and spherical aberration and coma of the cornea, photopic, mesopic pupil sizes, looking at lenticular and corneal astigmatism. You've got all these things that could be keys to multifocal and toric IOL selection. And what I want to know is, do you use that sort of data set, and has it improved your outcomes? And how do you get all that information?
Right, so the greatest thing is we've had the Epic station, specifically the OPD and now OPD III, from the beginning of when it first came out, and it's made us way more efficient. Our technicians all utilize the technology, and so we're able to capture all the data from spherical aberration, pupil, mesopic, scotopic size. We can get all the data, corneal versus lenticular astigmatism, as you mentioned, and angle kappa, now angle alpha. And so as a cataract surgeon, I need to figure out quickly in a cataract evaluation what's going to be the best technology, at least from an objective standpoint for patients, and having all these data points help me. So for example, if I'm going to put a monofocal lens in, I need to know how much spherical aberration there is in the cornea to know if I should use a zero aberration monofocal lens or a lens with some negative spherical aberration. If I'm going to do a toric IOL, I need to know if it's mostly corneal versus lenticular astigmatism. Obviously, if it's mostly corneal astigmatism, OPD III will actually distinguish those two and to break it out, and so I'll be able to put a toric IOL or do astigmatic incisions depending on the magnitude of the astigmatism. And lastly, determining if I want to use a multifocal or extended depth of focus versus an accommodating lens implant for the premium IOLs. Having the angle kappa and angle alpha information lets me know if those lenses are going to be well tolerated. So it's a lot of data points in a very short period, in a minute or less captured, to help me decide a lot of things objectively for IOL decision making.
Okay, thanks. So anyone else? Toby, any thoughts?
Well, I think what I really like about having the OPD is having that data before I actually enter the room to have the consultation. A lot of practices like to have a biometry day after they've already done the consult. But for me, it allows me to have all that information to really narrow down what the discussion is going to be. So it streamlines my practice because now I know what I'm going to be able to offer to that patient, and I'm not wasting time discussing options that may or may not be available for that patient.
The maps on the OPD III are very easy to understand, and I actually use it as a teaching tool for my patients, because unless the patients understand what it is they have and why they may need to pay something out of pocket, they're not going to be willing to write that check. But once they see their astigmatism as a bow tie on the axial map, or see their, let's say, point spread function that may not let them be a multifocal candidate, they better grasp these maps, and I very much rely on this as a teaching tool for my patients.
I think on the same token, also patients with abnormal corneas or irregular astigmatism, it really helps highlight that, so that not only can you determine who's a great candidate for these more advanced technology and lens implants and such, you can also very quickly be able to assess who may not be the best candidate.
And just to echo everything else said, I mean, one of the best things is having this computer in our room that synchronize our Epic and OPD are in a totally other part of the office, but we're able to show the patient what's good, what's bad, why we might recommend that, and it actually is not that difficult to explain to patients. You can show them with pictures, and they understand that a lot better.
2017 brings the 50th birthday to Marco Ophthalmic. The last 50 years have been an all-American dream come true. Thank you for being a part of our dream.